Thank you for choosing Hackensack Meridian Health. Today you'll be watching a post-prostatectomy instructional video on catheter use at home, your diet, and your activity after the surgery. Please watch this video closely, but your nurse will also be going over it at the bedside with you before discharge. Let's talk about your diet at home. After the surgery, you're going to be maintaining a clear liquid diet to prevent constipation. Clear liquids are anything that you can see through, such as chicken broth, apple juice, and cranberry juice. You're going to maintain a clear liquid diet until you pass gas. After you pass gas, you're going to advance to a full liquid diet. Full liquids are things such as Furina, pudding, and thicker, creamier soups. Once you have a bowel movement, you're going to advance to a regular diet. A trade nursing secret that you should know is that you can cheat on your clear liquid diet from day one with prunes and prune juice. Prunes and prune juice help move the bowels along. One of the most commonly asked questions after surgery is, can I resume my normal physical activity? So let's talk about your activity restrictions after your surgery. After the prostatectomy, for 6 weeks, no heavy lifting, which means nothing over 10 pounds. You may walk up the stairs, but do them slowly when you first have your surgery because they might be more painful. It's very important to walk after the surgery to prevent constipation, keep the blood flowing, and prevent pneumonia. It's important to keep everything moving. So you're going to want to walk 4 to 5 times a day. Another one of the most commonly asked questions after the surgery is, can I shower? The answer to that is yes. Showering is perfectly fine. Allow the soap and water to run down the incisions, but no direct scrubbing on them. And then when you get out of the shower, pat them dry. No soaps, lotions, ointments on the incisions. Depending on your surgeon, you're going to have a different bandage covering the incisions. You may have steri strips, which are thin white band-aids. Those are going to fall off on their own. Or you might have a plastic square. Those have to come off prior to entering the shower. Your nurse will give you specific instructions and will show you how to do it before you go home. There is also a dressing that is covering the hole from where the drain was in your abdomen. Your nurse is going to show you exactly what to do with this, but you're going to take that dressing off before you get into the shower and reapply a dry one when you're done. And if you're thinking about taking a bubble bath, sorry, not yet. No baths, swimming, or hot tubs after the surgery. Your nurse is going to be giving you prescriptions directly from your surgeon. Most of the time, you'll receive a prescription for pain medication and an antibiotic. However, these are specific to your surgeon, and please check with your nurse. There are also 2 over-the-counter medications that you may be taking after your surgery. These are typically Tylenol and Colace. Colace is a stool softener that you're going to be using to help your sleepy bowel after the surgery, which is caused by the anesthesia. If you are taking any blood thinners at home, please check with your nurse to confirm whether you are going to restart them after your surgery. Now let's review the bags that you're going to be going home with. This is the catheter that's inserted into the bladder. This is the piece that comes out where you're going to be attaching the overnight bag and the leg bag. First, let's start with the leg bag. The leg bag has a cap on top, as does the overnight bag. These caps are just to protect the bags when they're not in use if they're sitting on the table. You can take the cap off first, but don't lose your cap. Then you're going to need 2 alcohol swabs. Take your alcohol swab and clean the top of the leg bag. Then take a second alcohol swab and clean the actual catheter. Remember, there might be some urine coming out as you clean. That's perfectly fine. Now you're going to take the leg bag and insert it into the catheter, just by pushing it in. Then attach the leg bag to your thigh with the provided Velcro straps. And then throughout the day, you walk over to the toilet, you take your thumb, you push the green clip open, all of the urine will come out and drain into the toilet, and then when it's done, you just push it closed. Keep this bag on throughout the day. Then, when you're ready to go to sleep, you're going to attach the overnight bag. The overnight bag has tubing with a cap on top. Take this cap off. Also, don't lose this cap. Take a clean alcohol swab. Clean the top of the overnight bag. Then you have another alcohol swab ready. You're going to take off the leg bag with your fresh alcohol swab. Clean the catheter again. You want to clean the catheter every time you are switching bags. Then you're taking the overnight bag and you're simply pushing it into the catheter. This overnight bag needs to go at the bottom of your bed, below the level of the bladder, with the tubing as straight as possible, just to help gravity drain the urine down. Then you're going to empty this bag in the morning when you're ready. With your thumb and your forefinger, you take the 2 green clips, you pull them out of the little house, then you take your thumb, pop open the metal clip, and all of the urine will drain into the toilet. You can then switch back to the leg bag for the rest of your day. Don't forget to stick to your follow-up appointment to see your surgeon a week after the surgery. You don't want to get stuck with your catheter, right? Prior to going home, if you have any questions, please do not hesitate to ask your nurse. Thank you for choosing us at Hackensack Meridian Health, and it has been a pleasure taking care of you on 9PE.